Begin with something extremely simple, a breath. For most of us, breathing is the easiest thing to do because oxygen is naturally available in the air. But for many COVID-19 patients, breathing is not that simple because oxygen is an expensive luxury. But now the country is facing a crisis as oxygen cylinders go missing, straining hospitals' capacity to provide this life-saving gas as demand for oxygen grows. Gina Kirori begins our broadcast.
It has by extension been the lifeline many have hung onto, gasping for its precious elements in a bid to fight off the unrelenting effects of the virus. For James, not his real name, oxygen would prove to be what got him out of the intensive care unit after a tumultuous night of transitioning from one hospital to another in search of it.
I was put on oxygen, both in KU. When I talked to the doctor, he said that it is 80% and that was below the expected level of 90%.
His condition had deteriorated to an extent. Many of those around him began to spread rumors that he had passed on.
I was taken to an isolation room where I was alone. It was only the doctors and other service providers who were visiting me, whom I could talk to.
But this very lifeline is now in short supply, putting lives of COVID patients who need it at risk.
All the hospitals are going through a medical oxygen crisis.
But as the medical fraternity raises alarm over the looming crisis, the government finds itself accused of lack of seriousness.
If we continue like this, the hospitals are going to miss oxygen. We are going to lose patients. Why is the government not taking the oxygen crisis as something that needs to be addressed with a lot of concern?
The Ministry of Health, however, is shifting blame.
We have got about 20,000 oxygen cylinders that are out there in people's homes, that are in hospitals and other institutions.
Any cylinder you have in your hands can save somebody's life.
The ministry has, however, failed to explain how it can lose track of those who have oxygen cylinders in their homes. COVID-19 is a respiratory illness that makes the lungs vulnerable to inflammation and filling it with fluid, thereby making it difficult to process oxygen and carbon dioxide. This is what makes breathing difficult. Supplemental oxygen aids in the process by increasing the amount of oxygen in the lungs and blood, therefore helping a patient recover from the virus. In light of the shortage, some private companies are now offering to donate oxygen to all public hospitals across the country. The simple act of breathing in and out has proven to be of immeasurable value for many of those that had to fight COVID-19 within the confines of hospitals or even at home. But now, the oxygen cylinders that prove to be the heroines in this situation are scarce, leaving thousands of patients vulnerable as they try to fight off the virus. Gina Kirori, NTV.